When it comes to gut complaints, diarrhea and constipation are some of the most common, but they can also be signs of something more serious. Let's break them down. Diarrhea is defined as the passage of more than 3 loose or watery stools in a 24-hour period. It can be classified as acute, persistent, or chronic depending on the duration. Signs and symptoms of acute diarrhea include mucoid stool and tenesmus, which is that feeling of needing to go even when the bowel is empty. You may also experience fever and severe abdominal cramps, inability to keep fluids down, or severe muscle and joint pain. On abdominal assessment, patients may have generalized tenderness and bowel sounds that are hyperactive, normal, or even absent depending on the severity. The biggest concern with diarrhea is secondary complications, especially dehydration. It's important to look for thirst, dry mouth, poor skin turgor, also things like tachycardia, prolonged cap refill, and orthostatic hypertension. Additionally, decreased urinary output or inability to sweat, electrolyte imbalance, and in severe cases, sepsis can develop. Prehospital management is supportive but critical. It's important to get a detailed history and a focused gastrointestinal, cardiovascular, and neurological assessment. The main treatment would be fluid repletion. Transport may be needed if there's evidence of severe dehydration, electrolyte disturbances, or other red flags. Now we move on to constipation. Constipation is defined as infrequent passing of stools, excessive straining, a sense of incomplete evacuation, and hard stools or prolonged or failed attempts to defecate. Primary constipation is often lifestyle related, while secondary constipation may result from other medical conditions. Some of the risk factors include age over 65, female sex, low fiber intake, sedentary lifestyle, and medications that induce constipation. Prehospital management focuses on detailed history and abdominal assessment, fluids and analgesia to improve comfort, identifying red flags such as an obstruction, and transport if indicated. Finally, we move on to fecal incontinence. This is the large involuntary leakage of fecal matter or inability to control bowel discharge. It's actually way more common than many think, affecting up to 10% of adults. Red flags to look out for is sudden onset, bloody stools, and unexpected weight loss. These could signal more serious pathology such as a malignancy, inflammatory bowel disease, or neurological compromise. Some key takeaways for diarrhea, constipation, and fecal incontinence are good history taking and focused assessment, symptom relief and fluid management where appropriate, identifying red flags early, and ensuring timely transport and escalation. Even something as simple as diarrhea can progress to life-threatening dehydration. And sudden incontinence isn't just embarrassing, it can be a sign of something more serious.